Let's talk about diabetics for just a minute. This is a meta-analysis of 19 different studies. Again, let me remind you what a meta-analysis is. A meta-analysis takes several studies that were all done to look at the exact same thing. So they were studies done at different universities throughout the country. So they pool all the data together because they're all looking for the same thing. And so then you study those studies. So when you get a conclusion drawn, it is recognized as being absolute. Doctors and researchers do not argue with the results of a meta-analysis because it says, you know what, everybody's concluding the same thing, this must be true. And so in the meta-analysis of these 19 different studies, they looked at the relationship of your vitamin D level and your risk of type 2 diabetes. For individuals that had vitamin D levels higher than 25, they had a 43% lower risk of developing type 2 diabetes. It is reasonable to say if it was even higher, the risk would even be better. See, so bottom line is that you can enjoy a reduction in your risk of diabetes if you are taking a good multiple vitamin and mineral that has vitamin D in it. Researchers are quick to say that you need to understand that there is vitamin D3, known as cholecalciferol. That is the active vitamin D in your body. That is what your body uses, and your immune system needs, your brain needs, your cells of your body need, obviously your bone needs. D2 is the synthetic version that your liver has to convert anyway to D3. Well, guess what? If your liver could do that to start with, you wouldn't be vitamin D deficient. You'd be able to make enough D with the sunlight that we're exposed to. So when we're compromised with vitamin D, it traditionally is because we don't have a healthy liver, healthy intestinal tract, and healthy kidney, which those are the ones in conjunction with the sun exposure that lead you to ultimately form vitamin D, which is the healthy D3, the cholecalciferol molecule.